So today we are talking about the trends in healthcare. This is from the DHO book, chapter 1, and this is the day 2 of the lesson. By the end of this, you should be able to identify at least 5 current trends or changes in healthcare. Cost containment is trying to control the rising cost of healthcare and achieve the maximum benefit for every dollar spent. So healthcare is expensive. Pharmaceuticals are expensive. Medicine is expensive. Diagnostic tools are expensive. My daughter recently had physical therapy, and for the evaluation alone, it was just one visit for about 1 hour long, cost $560. She had 8 to 9 visits total, and the total cost of her physical therapy cost $2,600. So thankfully, I have insurance that covered the majority of it. But for those people who are low income or do not have insurance, they would not be able to pay $2,000, over $2,000 for therapy, and more than likely would go without having physical therapy. There's several reasons for high healthcare costs, and one is for technological advances. Highly technical procedures can cost hundreds of thousands of dollars. The diagnostic tools themselves can cost millions, so just to probably have that MRI machine there at the hospital, it's a lot of money. And then advanced technology does allow people to survive illnesses that used to be fatal, but these individuals may require expensive and lifelong care. So you may survive something, maybe like being an injury that caused you to be quadriplegic. Quadriplegic is when you have an injury to your spinal cord in your neck area and all 4 limbs are affected. So you're able to live longer, but with that you need a lot more care, a lot more expensive care, and expensive equipment. Another reason for high healthcare costs is the aging population. More pharmaceutical products are used by the elderly, so there's some patients who may take 20 to 30 medications a day, and that's a lot, and those all cost quite a bit. Some people try to go to Canada to get their medications because it's cheaper there. And as a result of living longer, you have more chronic diseases, which also results in the need for more frequent healthcare services. So the elderly patients are going to more doctor visits, they're seeing more specialists, having more diagnostic tools done. Another reason for high healthcare costs is the cost of health-related lawsuits. This forces healthcare providers to obtain expensive malpractice insurance, and this can cost quite a bit, especially for doctors and surgeons. And doctors may also order diagnostic tests, even though it might not be necessary, but they want to cover themselves and order them just in case. All healthcare practitioners need to make every effort to avoid lawsuits by practicing defensive healthcare. Healthcare costs could rise to levels that could prohibit providing services to all individuals. Everyone should have equal access to care regardless of their ability to pay. Most agencies that deliver health care are trying to provide quality care at the lowest possible price. And unfortunately, here in the U.S., not everybody has equal access to care due to not being able to afford it or not having insurance, unfortunately. There's many methods of cost containment, and they can include diagnostic-related groups, reduce reimbursement for hospital-acquired conditions, replace fee-for-service compensation with value-based compensation or bundled payments, combination of services, outpatient services, mass or bulk purchasing, early intervention and preventive services, and energy conservation. You will see that some of the words are red during the presentation, and that's because those are your vocabulary words, and they're also red in your book. So diagnostic-related groups. One way Congress is trying to control costs for government insurance plans, such as Medicare and Medicaid. So Medicare is the insurance for the elderly, and Medicaid is the insurance for those who are low income, people who may have some mental health diagnoses, or who also may be on disability due to they're not able to work. Patients with a certain diagnosis who are admitted to hospitals are classified in one payment group. So therefore, if I went in to have hip surgery, if I did really well and went home the next day versus Susie Q, who went in to have hip surgery, She was not able to control her pain. She was not able to step on her feet or on her foot. She was in the hospital for 2 or 3 nights. The hospital would get paid the same for me as they would for Susie Q. So they might have made some money with me, and they probably lost some money with Susie Q. So a limit is placed on the cost of care, and the agency providing the care receives this set amount no matter what happens. That agency may make extra money or lose money. So for me, they might have made some money, but for Susie Q, they probably lost money because she was in the hospital longer than was expected. So as a result of DRG, sometimes hospitals may discharge too quickly. Medicare penalizes hospitals, though, if a patient is readmitted within 30 days. So if a patient was in the hospital, they discharged them and sent them either home to a skilled nursing facility to a home care. And for whatever reason, the patient went back to the hospital and was readmitted, they would get paid less during that second episode of care from Medicare or Medicaid. So hospitals need to be careful on who they discharge the patients to. They don't want to discharge them to a company who sends a lot of patients back to be readmitted. They want to discharge them to a company that has a low hospital readmittance rate. So also skilled nursing facilities, rehab facilities, and home care, they have to make sure they're on top of things so that if a patient does come to them, and if something starts to happen, they get it taken care of quickly and call the doctor so that it doesn't get a lot worse and the patient does end up back in the hospital. Of course, if needed, then the patient does need to be readmitted to the hospital no matter what for the safety of the patient. DRGs may require the hospital to share the payment with the rehab facility or with the home care agency. So they would be given one lump sum for that hip patient, whether it included their after hospital care. So then that would be dispersed between the two companies. Rehab and home care is cheaper than staying in the hospital, though. Reduced reimbursement for hospital-acquired conditions. Medicare does not consider hospital-acquired infections as complications of a condition. Payments are reduced for conditions caused by the hospital. Infection control is big in a hospital. So we talked about how sometimes the hospitals discharge too quickly, but it also goes on the other end that sometimes if someone is in the hospital too long, they come out with another diagnosis because they get an infection while they're there. So someone may go in with congestive heart failure and they come out with pneumonia. So the doctors and nurses have to find that fine line of discharging when it's appropriate so that it's not too soon, but yet they're not in there super longer where they may acquire another infection. Another cost containment is replace a fee-for-service compensation with value-based compensation or bundled payments. So a fee-for-service pays healthcare providers for each service rendered, so there's little incentive to consider the cost or necessity of services rendered. So therefore, that patient went in to get for their hip replacement, their PT evaluation would be paid separately, their OT evaluation would be paid separately, the nursing care would be paid separately, the anesthetics would be paid separately, their Tylenol would be paid separately. Compared to the value-based or bundled payments, which makes healthcare providers consider the necessity of various services or treatments. Providers are paid a certain amount for each diagnosis or disease. So the value-based compensation or the bundled payments are very much like the DRGs. The difference is the DRGs are for Medicare and Medicaid patients for the government insurances. The value-based compensation or the bundled payments are specifically for the private health insurances. Here's a little video. We're not going to watch it now because you won't be able to hear the words in it with the video. So make sure you go to Google Classroom and look for the Google Slides for this segment and watch that video. It explains the fee for services more in the bundled payments. The video is about 7 years old, so it does talk about these services being new, which they're not, but it does explain those services pretty well. Another way to save costs is a combination of services. This is done to eliminate duplication of services. When healthcare agencies join together and share specific services, care can be provided to a larger number of people at a decreased cost per person. So this might be large labs versus small labs. It's cheaper to send a lab into a large lab where they have lots of equipment, big equipment. They do thousands of labs per day versus a smaller lab. Kind of thinking of it Sam's versus the gas station market. It's going to be cheaper to go to Sam's to buy your milk and your eggs than it will be to go to the gas station to buy your milk and your eggs. Outpatient services. This is when patients have a service and they are not admitted to the hospital. Reducing the length of hospital stays and decreasing the need for hospital admissions, which then lowers the cost of health care. Open heart surgery right now, they're in the hospital for about 4 to 7 days, and it used to be that they were in the hospital for several weeks, which was obviously quite expensive. Now, if the patient needs more care, they're either sent to a skilled care facility or to home care if that extra care is needed, which saves money. Many surgeries, radiographs, diagnostic tests, and many other procedures are now outpatient. So it used to be that patients would stay in the hospital in order to get some of those diagnostic tests done. Now, if they are safe to discharge, they're discharged and then they come back for those diagnostic tests. Mass or bulk purchasing, buying equipment and supplies in large quantities or at reduced prices. You combine the purchases of several different agencies and then also combine the purchases of different departments in a single agency is also going to save money. So this is better for the Sam's versus the gas station market. It's going to be more expensive to buy stuff at the gas station because they buy a smaller number of supplies than it is to go to Sam's. Early intervention and preventive services. Providing care before acute or chronic disease occurs is crucial. Preventing illness is more cost-effective than treating illness. Methods can include patient education, immunizations, regular physical examinations, easy access to preventative health care services. Those with limited access to health services use expensive emergencies rooms and acute care facilities more frequently. So if somebody doesn't have easy access to their doctors, and it may be due to cost, then they tend to wait until they get really sick and they go to the ER, or they may go to the ER even when it's for something small, for something that they could have gone to their primary care facility or their primary care physician, but because they don't have a primary care physician, they go to the ER, which is much more expensive. Another way to save money is just with energy conservation. So monitoring the use of energy to control costs and conserve resources. Major expenses can include electricity, water, and or gas. And many times they perform energy audits. And this is usually done yearly to see where they can save money at. So methods to conserve energy is to use energy efficient facilities, monitoring, maintaining heating and cooling systems, installation and thermopane windows, stop water loss, energy efficient bulbs, infrared sensors to turn water faucets on or off, and alternative forms of energy and recycling. Another way to save costs is the quality of healthcare should not be lowered simply to control costs. So there's an agency called the Healthcare Research and Quality, and this prevents this from happening. They research the quality of healthcare services to make sure that healthcare is safer, more accessible, equitable, affordable, and of higher quality. So no matter how much an agency or hospital is trying to save money, they still have to provide good quality care. So again, quality of healthcare should not be lowered simply to control costs. Every healthcare worker must make every effort to provide quality care while doing everything possible to avoid waste and to keep expenditures down. So healthcare workers need to be efficient. So let's say if a nurse is doing wound care and they need sterile equipment, it's important to only open up the equipment that is needed, because if they open up a bunch of packages, if it's not needed, it gets thrown away, or maybe something drops on the floor because they opened it up too soon, and again, it has to be thrown away, and that's wasting supplies. Consumers must also assume more responsibility for their own care, become better informed of all options for healthcare services, and follow preventative measures to avoid or limit illness and disease. So it's also important that consumers go and get their yearly physical that if they start to feel sick or a little bit sick, they go and get it checked out, because the longer the wait, the longer they wait, the worse it can be and the more expensive it can be. So I apologize. You probably hear my dog barking. She wants attention. So I apologize for that. Oh, and we're all set. The closing work for the day were what are some costs, or what are some ways to cut the cost of healthcare? So you can go ahead and think about those. Be sure to contact me if you have any questions, and don't forget to go back to the Google Slides and Google Classroom so you can watch that one video on bundled payments.